Bedrest is a common medical intervention. It restricts a patient's mobility, necessary for recovery from illness, surgery, or injury. Bedrest can range from a few days to an extended period. It involves more than just staying in bed, aims to promote healing and prevent complications. Limiting activity directs energy towards recovery. Bedrest is tailored to individual needs. It offers benefits but also potential risks. Understanding bedrest is paramount. Proper bedrest care is crucial for a patient's well-being. It goes beyond simply providing comfort. It plays a vital role in preventing complications and promoting recovery. Effective bedrest care involves maintaining hygiene, proper nutrition, and emotional support. But preventing pressure ulcers is a primary concern. These develop from prolonged pressure. This restricts blood flow and can lead to tissue damage. Maintaining mobility is essential. Gentle exercises prevent muscle atrophy and improve circulation. Addressing psychological well-being is also crucial. Emotional support and engagement aid recovery. Caregivers play an indispensable role in providing bedrest care. They ensure the patient's comfort, safety, and well-being. This role requires patience, compassion, and a diverse skill set. Caregivers may be family members, friends, or professionals. They must be equipped with the knowledge and skills to provide effective care. This includes understanding the patient's medical condition and care plan. Communication is paramount in this role. They assist with a wide range of tasks, including personal hygiene and medications. Monitoring the patient's condition is crucial. They also provide emotional support and companionship. Caregivers advocate for the patient's needs and ensure their voice is heard. Their dedication creates a supportive environment that promotes healing. Bedrest care encompasses a wide range of tasks and responsibilities. It's not just about assisting with daily activities. It's about understanding the patient's holistic needs and providing care that addresses their physical, emotional, and mental well-being. This holistic approach is crucial for ensuring the best possible outcomes during the bedrest period. One critical aspect of bedrest care is maintaining the patient's hygiene. This includes assisting with bathing, oral care, hair care, and toileting. Regular hygiene practices not only promote comfort, but also play a significant role in preventing infections. Caregivers must be knowledgeable about proper hygiene techniques, especially for patients with limited mobility. Another vital component of bedrest care is ensuring proper nutrition and hydration. Bedridden patients may have a decreased appetite or difficulty eating independently. Caregivers must encourage a balanced diet and provide assistance with feeding as needed. Monitoring fluid intake is equally important to prevent dehydration, which can hinder recovery. Beyond these essential tasks, bedrest care also involves managing the patient's environment. This includes ensuring a comfortable room temperature, adequate lighting, and a clean and clutter-free space. Providing entertainment options such as books, magazines, or access to television or music can help alleviate boredom and promote emotional well-being. Section 5. Mastering the essentials for optimal well-being. Mastering bedrest care requires knowledge, skills, and compassion. Understand body mechanics, safe handling, and communication. This empowers safe care and minimizes injury risks. Proper techniques prevent caregiver injuries. Use assistive devices and maintain a neutral spine. Training prevents falls and injuries. Effective communication is paramount. Understand and respond to patient needs. Be attentive to non-verbal cues. Communicate with family and healthcare team. Ensure everyone is informed. Mastering these skills promotes healing and well-being. Section 1, the cornerstone of care, communication. Effective communication is paramount in bedrest care. Clear and compassionate communication ensures that the patient's needs are understood and met. Caregivers must be skilled in both verbal and non-verbal communication techniques. Non-verbal communication is equally important. Effective communication extends beyond the patient-caregiver interaction. Hygiene and toileting, maintaining dignity and comfort. Maintaining personal hygiene is essential for bedridden patients. Caregivers ensure patients feel clean, comfortable, and respected. These routines help prevent infections and skin breakdown. Bathing should be gentle and thorough. Use mild soap and warm water and ensure the skin is dry. Oral care prevents infections and promotes health. Brush teeth twice a day and offer mouthwash. For incontinent patients, establish a toileting schedule. Use absorbent pads and change them frequently. Maintain a compassionate and respectful approach. Keep the environment clean and comfortable. Proper nutrition and hydration are vital for healing and recovery, especially for bedridden patients. Caregivers ensure patients receive adequate calories, fluids, and essential nutrients. This involves understanding dietary needs and providing appealing meals. Offer a variety of foods to ensure a balanced intake of vitamins, minerals, and fiber. Encourage the patient to drink plenty of fluids throughout the day. Medication adherence is crucial for managing health conditions and promoting recovery, especially for bedridden patients who may be on multiple medications with complex schedules. Caregivers play a vital role in ensuring the patient receives the correct medications at the right time and dosage, as prescribed by their healthcare provider. Start by creating a clear and organized medication schedule. Use pill organizers, medication charts, or smartphone apps to track medication times and dosages. Communicate with the patient's healthcare provider about any concerns or questions regarding their medications, including potential side effects or interactions. When administering medications, double-check the medication name, dosage, and route of administration against the prescription label. If the patient has difficulty swallowing pills, consult with the healthcare provider about alternative forms of medication, such as liquid formulations or crushed tablets. Monitor the patient for any adverse reactions or side effects from their medications. Report any unusual symptoms or concerns to the healthcare provider immediately. Remember, accurate medication management is essential for ensuring the patient receives the full benefits of their treatment plan and avoids potential complications. While bed rest restricts mobility, it's essential to encourage some level of activity and exercise to prevent complications associated with prolonged immobility, such as muscle weakness, joint stiffness, and blood clots. Caregivers can play a vital role in implementing simple yet effective exercises and movements to maintain muscle strength, improve circulation, and promote overall well-being. Start by incorporating range of motion exercises into the patient's daily routine. These exercises involve gently moving each joint through its full range of motion, helping to prevent stiffness and maintain flexibility. Caregivers can assist with these exercises, providing support and ensuring proper form. Encourage the patient to engage in active exercises whenever possible. This could include simple movements like ankle pumps, leg raises, and arm circles. These exercises help improve circulation, strengthen muscles, and prevent blood clots. Start with a few repetitions and gradually increase the number as the patient's strength improves. Even small movements can make a big difference. Encourage the patient to change positions frequently, shifting their weight in bed and using pillows for support. This helps prevent pressure ulcers and promotes circulation. Remember, incorporating activity and exercise into the bed rest routine is crucial for minimizing complications and promoting a faster recovery. Monitoring vital signs is a fundamental aspect of bed rest care, providing valuable insights into the patient's overall health status and alerting caregivers to any potential problems. Caregivers should be familiar with the procedures for measuring and recording vital signs, including temperature, pulse, respiration, and blood pressure. Temperature can be measured orally, rectally, or using a tympanic thermometer. Pulse can be measured at the wrist or neck, counting the number of beats per minute. Respiration is assessed by observing the rise and fall of the chest, counting the number of breaths per minute. Blood pressure is measured using a sphygmomanometer and stethoscope. Establish a schedule for monitoring vital signs based on the patient's condition and the healthcare provider's instructions. Record the measurements accurately and report any abnormal findings to the healthcare provider immediately. Be aware of the normal ranges for each vital sign and any factors that might affect them, such as medications or underlying medical conditions. Remember, vigilance in monitoring vital signs is crucial for early detection of potential complications. By recognizing and reporting any abnormalities promptly, caregivers can help ensure timely intervention and prevent further deterioration of the patient's condition. Bed rest can take a toll on a patient's emotional well-being, leading to feelings of isolation, boredom, anxiety, and depression. Caregivers play a vital role in providing emotional support and companionship, fostering a positive and nurturing environment that promotes healing and well-being. Start by creating a supportive and empathetic space for the patient to express their feelings and concerns. Active listening is paramount. Pay attention to what they're saying, both verbally and non-verbally, and validate their emotions without judgment. Offer words of encouragement and reassurance, letting them know they're not alone in their journey. Combat boredom and isolation by engaging the patient in meaningful activities. This could include reading aloud, playing games, listening to music, watching movies, or engaging in hobbies they enjoy. Encourage social interaction by facilitating visits from family and friends, either in person or virtually. Remember, emotional well-being is just as important as physical health. By providing companionship, encouragement, and a listening ear, caregivers can make a significant difference in the patient's overall experience during bed rest. As the eyes and ears for the healthcare team, caregivers play a crucial role in recognizing and reporting any changes in the patient's condition. Early detection of potential complications is essential for timely intervention and prevention of further deterioration. Caregivers should be vigilant in observing the patient, documenting their findings, and communicating any concerns to the healthcare provider promptly. Pay close attention to any changes in the patient's physical appearance, such as skin color, temperature, or the presence of wounds or rashes. Monitor their mental status, noting any changes in alertness, orientation, or mood. Observe their behavior, including their appetite, sleep patterns, and bowel and bladder habits. Document any changes you observe, noting the date, time, and specific details. Maintain open communication with the healthcare provider, reporting any unusual findings or concerns. Don't hesitate to advocate for the patient's needs, ensuring their voice is heard and their concerns are addressed. Remember, caregivers are an integral part of the healthcare team. By being observant, proactive, and communicative, they can play a vital role in ensuring the patient receives the best possible care and support throughout their bed rest journey. Understanding body mechanics, the foundation of safe movement. Body mechanics refers to the way we move our bodies during daily activities. Use the strongest muscles to perform tasks, maintain a stable center of gravity, and avoid awkward postures. When lifting, use your legs, not your back. Keep your back straight, bend at the knees. Avoid twisting or jerking movements. Pivot your feet to change direction. Maintain a stable center of gravity and keep your weight evenly distributed. Incorporate these principles to minimize injuries and ensure optimal movement. Positioning for comfort and support. Promoting circulation and preventing pressure ulcers. Proper positioning is essential for bedridden patients to promote comfort and prevent pressure ulcers. Caregivers use pillows, wedges, and other devices to relieve pressure on bony prominences. One common position is the supine position, where the patient lies flat on their back. Place a pillow under the calves to prevent pressure on the heels. Another common position is the side-lying or lateral position. This position helps reduce pressure on the tailbone. Regular repositioning is crucial to redistribute pressure. Turning and repositioning, preventing complications and maintaining skin integrity. Turning and repositioning bedridden patients is essential for preventing a range of complications, including pressure ulcers, respiratory problems, and muscle and joint contractures. Caregivers play a vital role in this process, ensuring the patient is moved safely and comfortably while maintaining their dignity and respect. Before turning or repositioning a patient, always explain the procedure and obtain their consent if possible. Gather any necessary equipment such as pillows, wedges, or draw sheets, and ensure the bed is at a comfortable working height to minimize strain on your back. If the patient is able to assist, encourage them to participate as much as possible, as this helps maintain their strength and independence. However, never attempt to move a patient beyond their capabilities or without proper assistance, as this could result in injury to both you and the patient. After repositioning the patient, ensure they are comfortable and in proper alignment. Check for any signs of pressure on the skin, such as redness or blanching, and adjust their position as needed. Document the time and position change in the patient's chart and communicate any concerns to the healthcare team. Section 4. Transfer techniques, moving the patient safely and efficiently. Transferring a patient from the bed to a chair, wheelchair, or other surface requires careful planning and execution to ensure both the patient's safety and the caregiver's well-being. Proper transfer techniques involve using assistive devices when necessary, communicating clearly with the patient, and utilizing proper body mechanics to minimize strain. Before initiating a transfer, assess the patient's abilities and limitations. Determine if they are able to bear weight, follow instructions, and assist with the transfer. If the patient is unable to assist, a mechanical lift or additional caregivers may be required to perform the transfer safely. Explain the transfer procedure to the patient, providing clear and concise instructions. Encourage them to participate as much as possible, but be prepared to provide assistance as needed. Use assistive devices such as a gait belt or transfer board to provide support and stability during the transfer. After the transfer, ensure the patient is comfortable and secure in their new position. Adjust any pillows or supports as needed and make sure they have access to the call light or other means of summoning assistance. Document the transfer in the patient's chart, noting any difficulties encountered or assistance required. Section 5. Assistive devices, enhancing mobility and reducing strain. Assistive devices can significantly enhance a bedridden patient's mobility, promote independence, and reduce strain on caregivers. These devices range from simple aids like bed rails and grab bars to more complex equipment like wheelchairs and mechanical lifts. Choosing the appropriate assistive device depends on the patient's individual needs, abilities, and the care environment. Bed rails provide support and assistance when getting in and out of bed. They can also prevent falls by creating a barrier along the side of the bed. Grab bars, installed near the toilet and in the shower, offer stability and support during toileting and bathing. Walkers and canes can enhance mobility for patients who are able to bear some weight but require assistance with balance and stability. Wheelchairs provide mobility for patients who are unable to walk or have limited walking ability. Mechanical lifts are essential for safely transferring patients who are unable to bear weight or require significant assistance. These lifts minimize the risk of injury to both the patient and caregiver by reducing the amount of manual lifting involved. Section 6. Preventing falls, creating a safe environment. Falls are a significant concern for bedridden patients as they can lead to serious injuries and further complications. Caregivers play a crucial role in creating a safe environment that minimizes fall risks and ensures the patient's well-being. This involves identifying potential hazards, implementing preventative measures, and promoting a culture of safety. Start by conducting a thorough assessment of the patient's room, identifying any potential fall hazards. These may include clutter on the floor, loose rugs, inadequate lighting, or furniture in high-traffic areas. Remove or secure any potential hazards to create a clear and safe pathway for the patient. Ensure the patient's bed is at a safe height, allowing their feet to comfortably touch the floor when sitting on the edge of the bed. Use bed rails as needed to prevent falls, especially for patients who are disoriented or prone to wandering. Keep frequently used items such as the call light, telephone, and water pitcher within easy reach of the patient to minimize the need for them to reach or get out of bed unattended. Encourage the patient to wear non-slip footwear such as slippers or socks with grips when they are out of bed to enhance stability. Section 7. Exercise and range of motion, maintaining strength and flexibility. While bed rest is often necessary for healing and recovery, it can also lead to muscle weakness, joint stiffness, and decreased range of motion. To counteract these effects, it's essential to incorporate regular exercise and range of motion activities into the patient's daily routine. Even small movements can make a significant difference in maintaining strength, flexibility, and overall well-being. Range of motion exercises involve moving each joint through its full range of motion, helping to prevent stiffness and maintain flexibility. These exercises can be performed passively with the caregiver gently moving the patient's limbs or actively with the patient performing the movements themselves. Active exercises such as ankle pumps, leg raises, and arm circles can be performed in bed to improve circulation, strengthen muscles, and prevent blood clots. Start with a few repetitions and gradually increase the number and intensity as the patient's strength and tolerance improve. Encourage the patient to participate in activities they enjoy, such as reading, watching television, or engaging in hobbies, as these can provide mental stimulation and encourage movement. Remember, even small amounts of activity can make a big difference in maintaining the patient's physical and mental well-being during bed rest. Section 8. Collaborating with the healthcare team, ensuring coordinated and individualized care. Effective bed rest care requires a collaborative approach, with caregivers working closely with the healthcare team to develop and implement an individualized care plan that meets the patient's unique needs and goals. This collaboration ensures continuity of care, promotes communication, and fosters a supportive environment for both the patient and caregiver. Regular communication with the healthcare team is essential for sharing observations, reporting any changes in the patient's condition, and addressing any concerns or questions. Caregivers should feel comfortable advocating for the patient's needs and preferences, ensuring their voice is heard and their wishes are respected. The healthcare team can provide valuable guidance on positioning, turning, and transfer techniques, as well as recommend appropriate assistive devices and exercise programs. They can also assess the patient's risk for complications, such as pressure ulcers and blood clots, and implement preventative measures. Remember, effective bed rest care is a team effort. By working collaboratively with the healthcare team, caregivers can provide the best possible care and support for the patient, promoting their comfort, safety, and overall well-being. Section 1. The importance of skin care, safeguarding the body's protective barrier. Skin, the body's largest organ, serves as a vital protective barrier against infection, injury, and dehydration. For bedridden patients, maintaining skin integrity becomes even more crucial, as immobility increases their vulnerability to skin breakdown, pressure ulcers, and other complications. Caregivers play a pivotal role in safeguarding the skin's health through meticulous care, observation, and preventative measures. The skin's natural defenses are compromised when subjected to prolonged pressure, friction, and moisture, as often occurs in bedridden individuals. Pressure deprives the skin of adequate blood flow, leading to tissue damage and ulcer formation. Friction caused by rubbing against bed linens or clothing can irritate and abrade the skin, increasing the risk of infection. Moisture from perspiration, incontinence, or wound drainage can weaken the skin's protective barrier, making it more susceptible to breakdown. Caregivers must be vigilant in assessing the skin's condition, identifying potential problems early on, and implementing preventative measures to maintain skin integrity. This includes regular cleansing and moisturizing, meticulous management of incontinence, and proactive pressure ulcer prevention strategies. Remember, healthy skin is essential for overall well-being. By prioritizing skin care, caregivers can significantly impact the patient's comfort, dignity, and recovery. Regular and thorough skin assessments are paramount in preventing and managing skin complications in bedridden patients. Caregivers should be trained to identify early warning signs of skin breakdown, pressure ulcers, and other skin-related issues. Early detection allows for timely interventions, preventing minor problems from escalating into serious medical concerns. Begin by inspecting the patient's entire body, paying close attention to bony prominences such as the heels, elbows, hips and tailbone, which are particularly vulnerable to pressure ulcers. Look for any signs of redness, discoloration, warmth, swelling or tenderness. Note any breaks in the skin, blisters, rashes or other abnormalities. Observe the skin's texture and moisture level. Is it dry, flaky or excessively moist? Pay attention to any changes in the patient's skin, even subtle ones, as these can indicate an underlying problem. Document your findings accurately and report any concerns to the healthcare team promptly. Remember, early detection is key to effective skin care. By being observant and proactive, caregivers can play a vital role in preventing and managing skin complications, ensuring the patient's comfort and well-being. Maintaining the skin's natural moisture balance is essential for its health and integrity, especially for bedridden patients who may experience dryness and irritation due to immobility, medications, and environmental factors. Regular cleansing and moisturizing help remove dirt, sweat, and other irritants while replenishing lost moisture and promoting skin elasticity. When cleansing the skin, use a gentle pH-balanced cleanser and warm water. Avoid harsh soaps, antibacterial agents, or alcohol-based products, as these can strip the skin of its natural oils, leading to dryness and irritation. Pay particular attention to skin folds where moisture tends to accumulate, and ensure these areas are thoroughly dried after cleansing. After cleansing, apply a fragrance-free hypoallergenic moisturizer to the skin, focusing on dry areas and bony prominences. Moisturizers create a protective barrier, preventing moisture loss and promoting skin elasticity. Choose a moisturizer that is appropriate for the patient's skin type and any underlying skin conditions. Regular cleansing and moisturizing incorporated into the patient's daily care routine play a crucial role in maintaining skin integrity and preventing complications. Incontinence, a common issue among bedridden patients, poses significant challenges to skin integrity. Prolonged exposure to urine or feces can irritate the skin, disrupt its pH balance, and increase the risk of infection and pressure ulcer development. Caregivers must implement meticulous hygiene practices and utilize appropriate products to minimize skin exposure to moisture and protect its delicate balance. Establish a regular toileting schedule based on the patient's needs and patterns of incontinence. Offer toileting assistance frequently, even if the patient does not express an urge to void. This proactive approach can help prevent accidents and minimize skin exposure to moisture. When incontinence occurs, cleanse the affected area promptly and thoroughly using gentle, pH-balanced cleansing wipes or washcloths. Avoid harsh scrubbing or rubbing, which can further irritate the skin. Apply a moisture barrier cream or ointment to protect the skin from further irritation and promote healing. Choose absorbent incontinence products such as briefs or pads that are specifically designed for bedridden individuals. Select products that fit properly, wick moisture away from the skin, and control odor. Change these products frequently as soon as they become soiled to minimize skin exposure to moisture and prevent skin breakdown. Section 5. Pressure ulcer prevention. A multifaceted approach. Pressure ulcers, or bed sores, occur when prolonged pressure on the skin restricts blood flow and causes tissue damage. Preventing pressure ulcers requires regular repositioning, pressure-relieving surfaces, meticulous skin care, and nutritional support. Repositioning the patient every 2 hours redistributes pressure and allows blood flow to return to compressed areas. Use pillows, wedges, and other aids to support the patient's body and minimize pressure on bony prominences. Pressure-relieving surfaces, like specialized mattresses and cushions, distribute weight evenly and reduce pressure points. Meticulous skin care and nutritional support are essential for maintaining skin integrity and promoting wound healing. Section 6. Addressing pressure ulcers, stages, treatment, and prevention. Pressure ulcers are classified into stages based on tissue damage, from stage 1, redness, to stage 4, extensive tissue damage. Treatment varies by stage, from conservative management for stage 1 to specialized wound care for stages 3 and 4. Pain management is crucial, as pressure ulcers can be extremely painful. Preventing pressure ulcers involves regular repositioning, pressure-relieving surfaces, meticulous skin care, and nutritional support. Caregivers play a vital role in implementing these measures and monitoring for signs of skin breakdown. Section 7, promoting sensory stimulation, engaging the skin and enhancing well-being. The skin, a vital sense organ, provides valuable information about our environment and contributes to well-being. For bedridden patients, engaging the skin through touch, temperature and texture can enhance comfort and reduce anxiety. Gentle massage with soothing lotion can stimulate circulation and relieve muscle tension. Warm compresses provide comfort, while cold compresses reduce swelling. Providing different textures for the patient to touch can stimulate the sense of touch and provide comfort. This approach is particularly beneficial for patients with dementia or cognitive impairments. Section 8. Collaborating for optimal skin health. The caregiver's role in a multidisciplinary approach. Maintaining optimal skin health requires a collaborative approach with caregivers, nurses, physicians, wound care specialists, and dietitians. Effective communication and shared decision-making are essential for the best outcomes. Caregivers provide valuable observations about the patient's skin condition and the effectiveness of interventions. Regular skin assessments, documented and shared with the healthcare team, are crucial. By working collaboratively, caregivers ensure comprehensive and individualized care, promoting optimal skin health. Section 1. The threat of immobility, understanding skin breakdown and contractures. Immobility poses significant risks to the skin and musculoskeletal system, leading to pressure ulcers and contractures. Pressure ulcers range from mild redness to deep sores, causing pain and infection. Contractures occur when muscles or tendons shorten and stiffen, limiting joint movement. Understanding these mechanisms is crucial for caregivers to appreciate preventative measures. Proactive strategies can significantly reduce the risk of these complications. Prevention is always better than cure, and caregivers play a vital role in protecting the patient's skin and musculoskeletal health. Section 2. Proactive measures, the cornerstone of prevention. Preventing skin breakdown and contractures requires a proactive, multifaceted approach. Regular repositioning is paramount, shifting the patient's position at least every 2 hours. Consult with a healthcare professional for appropriate turning schedules and positioning techniques. Maintain skin integrity through meticulous hygiene practices. Cleanse the skin with a mild, pH-balanced cleanser and apply a fragrance-free, hypoallergenic moisturizer. Encourage active and passive range of motion exercises to maintain joint flexibility and muscle strength. For patients unable to move independently, perform passive range of motion exercises. Proper nutrition and hydration are essential for maintaining skin integrity and preventing complications. A balanced diet, rich in protein, vitamins and minerals, supports tissue repair and healing. Encourage protein-rich food like lean meats, beans and dairy products. Vitamin C, found in citrus fruits and leafy greens, is essential for collagen production. Adequate hydration maintains skin moisture and elasticity. Encourage the patient to drink plenty of fluids and monitor their intake. Consult with a registered dietitian to develop a meal plan that meets the patient's needs. Regular repositioning and promoting mobility are crucial for preventing skin breakdown and contractures. Movement redistributes pressure, stimulates circulation, and maintains muscle strength and joint flexibility. Establish a consistent repositioning schedule, changing the patient's position at least every 2 hours. Use pillows and wedges to support the patient and relieve pressure on bony prominences. Encourage active movement and assist with range of motion exercises. For patients unable to move independently, perform passive range of motion exercises. Collaborate with a physical therapist to develop an individualized exercise plan. Pressure-relieving surfaces, like specialized mattresses and cushions, prevent pressure ulcers by distributing weight evenly. These surfaces minimize pressure on vulnerable areas of the skin. Mattresses for pressure ulcer prevention consist of multiple layers that conform to the patient's body. Overlays and cushions provide additional pressure relief. Consult with a healthcare professional to determine the best option for the patient's needs. Remember, pressure-relieving surfaces are just one component of a comprehensive prevention program. Section 6. Skincare Essentials: Cleansing, Moisturizing and Protection. Maintaining the skin's natural moisture balance and protecting it from irritants are essential for preventing skin breakdown. Gentle cleansing, regular moisturizing and barrier creams help preserve skin integrity. Use a mild pH-balanced cleanser and warm water for cleansing. Avoid harsh soaps and alcohol-based products. Moisturize the skin after cleansing, focusing on dry areas and bony prominences. Barrier creams protect the skin from moisture and friction. Apply barrier creams to areas prone to moisture, like the perineal area and skin folds. Section 7. Early detection and intervention, recognizing warning signs. Early detection and intervention prevent minor skin issues from escalating. Regularly assess the patient's skin, especially bony prominences. Look for signs of redness, discoloration, warmth, swelling, or tenderness. Note any breaks in the skin, blisters, or rashes. Document findings and report concerns to the healthcare team promptly. Early detection is key to effective skincare, ensuring the patient's comfort and well-being. Section 8. Collaborative care, working together for optimal outcomes. Preventing skin breakdown and contractures requires a collaborative approach with a multidisciplinary team. Effective communication and shared decision-making are essential. Caregivers provide valuable observations about the patient's skin condition. Regular skin assessments, documented and shared with the healthcare team, are crucial. By working collaboratively, caregivers ensure comprehensive and individualized care, promoting optimal skin health. As we conclude our exploration of essential bedrest skills, it's crucial to emphasize the enduring importance of this aspect of healthcare. Bedrest demands a proactive and comprehensive approach to ensure the patient's well-being. It's about creating a supportive environment that fosters healing and minimizes risks. Bedrest care encompasses hygiene, nutrition, wound management, and emotional support. Caregivers play a vital role in meeting the patient's needs during this vulnerable time. Their dedication and compassion make a significant difference in the patient's experience and recovery. Effective bedrest care requires a blend of knowledge, skills, and compassion. Caregivers must understand body mechanics, safe patient handling, and effective communication. They need to assess the patient's condition, identify problems, and implement preventative measures. Knowledge empowers caregivers to make informed decisions and provide safe care. Skills, honed through practice, ensure efficient and confident task performance. Compassion fosters a supportive environment where the patient feels valued and understood. Bedrest care is rarely a solitary endeavor. It requires a collaborative approach, with caregivers working in tandem with a multidisciplinary team of healthcare professionals, including nurses, physicians, physical therapists, dietitians, and social workers. Effective communication, shared decision-making, and a unified commitment to the patient's well-being are essential for achieving optimal outcomes. Caregivers serve as the patient's advocate, communicating their needs, preferences, and concerns to the healthcare team. They provide valuable insights into the patient's condition, any changes observed, and the effectiveness of interventions. Regular communication and information sharing among team members ensure that the care plan is tailored to the patient's evolving needs and that potential problems are addressed promptly. Collaboration fosters a supportive and cohesive environment where expertise is shared, challenges are addressed collectively, and the patient benefits from a comprehensive and integrated approach to their care. By working together, the healthcare team can ensure that the patient's physical, emotional, and social needs are met, promoting their comfort, dignity, and overall well-being. While mastering essential bedrest skills is crucial, it's equally important to remember that we are caring for human beings with feelings, fears, and aspirations. Bedrest can be a humbling and isolating experience, stripping individuals of their independence and leaving them feeling vulnerable and dehumanized. Caregivers must approach their role with empathy, recognizing the emotional impact of immobility and striving to preserve the patient's dignity and respect. Simple acts of kindness, such as addressing the patient by their preferred name, engaging in conversations that acknowledge their individuality, and providing choices whenever possible, can make a world of difference in their experience. Maintaining privacy during personal care routines, providing opportunities for socialization and meaningful activities, and actively listening to their concerns without judgment are essential for fostering a sense of worth and respect. Remember, bedrest care extends beyond addressing physical needs. It's about nurturing the whole person. By approaching care with empathy and compassion, we can transform a potentially isolating experience into one that promotes healing, preserves dignity, and reinforces the patient's sense of self-worth. The rewards of caregiving, making a difference in someone's life. Caregiving, though demanding and often thankless, can be an incredibly rewarding experience. It offers a unique opportunity to make a tangible difference in someone's life, providing comfort, support, and companionship during a time of need. The bonds formed through caregiving can be profound, enriching the lives of both the caregiver and the recipient of care. Witnessing a patient's progress, however small, can bring immense satisfaction. Seeing a smile return to their face, hearing them express gratitude for your efforts, or simply knowing that you've made their day a little brighter can make all the challenges worthwhile. The act of caring for another human being, of easing their burden and offering a compassionate presence can be deeply fulfilling. Caregiving can also be a journey of personal growth, fostering patience, empathy, and resilience. It challenges us to step outside of ourselves, to put another person's needs before our own, and to find strength and grace in the face of adversity. The lessons learned through caregiving can extend far beyond the immediate situation, shaping our perspectives and enriching our lives in countless ways. The importance of self-care, supporting the supporters. Caregiving, while rewarding, can also be physically and emotionally demanding. The relentless nature of the role, coupled with the emotional toll of witnessing someone suffering, can lead to caregiver burnout, a state of physical, emotional, and mental exhaustion. To provide sustainable and compassionate care, caregivers must prioritize their own well-being and seek support when needed. Self-care is not selfish. It's essential for maintaining the energy and resilience needed to provide quality care. Make time for activities that bring you joy, whether it's reading, taking a walk, listening to music, or spending time with loved ones. Don't be afraid to ask for help from family, friends, or support groups. Sharing your experiences and feelings with others who understand can provide invaluable emotional support and prevent isolation. Remember, you cannot pour from an empty cup. By taking care of your own physical, emotional, and mental health, you'll be better equipped to provide compassionate and sustainable care to those who depend on you. Continuing education, staying current with best practices. The field of healthcare is constantly evolving, with new research, technologies, and best practices emerging regularly. To provide the highest quality bedrest care, caregivers must embrace lifelong learning and seek opportunities for continuing education. Staying current with the latest advancements in wound care, pressure ulcer prevention, mobility techniques, and other relevant areas ensures that patients receive the most up-to-date and effective care. Continuing education can take various forms, from attending conferences and workshops to reading professional journals and participating in online courses. Many organizations dedicated to patient advocacy and caregiver support offer valuable resources and educational materials. Seek out opportunities to expand your knowledge base, enhance your skills, and stay abreast of the latest developments in bedrest care. By embracing a commitment to ongoing learning, caregivers demonstrate their dedication to providing the best possible care for their patients. Continuing education not only benefits the patient, but also enhances the caregiver's professional development and job satisfaction. A call to action advancing bedrest care through education and advocacy. As we conclude this exploration of essential bedrest skills, let's remember that our work is far from over. There's a pressing need to raise awareness about the importance of bedrest care, to advocate for increased resources and support for caregivers, and to promote ongoing education and training for those involved in this critical aspect of healthcare. We can all play a role in advancing bedrest care. Educate yourself and others about the challenges of immobility, the importance of preventative measures, and the essential role caregivers play. Support organizations dedicated to patient advocacy, caregiver support, and research into bedrest-related complications. Advocate for policies that prioritize patient safety, caregiver well-being, and access to quality care. By working together, we can create a healthcare system that values bedrest care as an integral component of patient recovery, supports caregivers with the resources and recognition they deserve, and empowers patients to navigate the challenges of immobility with dignity and hope. Let us all commit to being champions for change, ensuring that every individual requiring bedrest receives the compassionate and comprehensive care they deserve.